Hello, my name is Dr. Michael Simmons. I'm a dentist, I'm an educator and a researcher, and I'm focusing on sleep-disordered breathing and what dentists can do to make a difference. And right now we have an enormous epidemic of problems that range from snoring to obstructive sleep apnea, and dentists should be screening for these things in their routine care of patients, along with checking for high blood pressure and perhaps making sure they do a good oral cancer screening. Sleep-disordered breathing affects a great percentage of our population, depending on the study that you look at. My impression is that 100% of dentists should be out there screening. Maybe 20% could treat if they were interested in the subject, and they would have to co-treat with physicians, hopefully sleep specialists. Dentists that are interested should be involved in the American Academy of Dental Sleep Medicine, the American Academy of Sleep Medicine. They should also try to get quality education. That means they get education from institutions and universities. And I think dentists can have an enormous impact on patients if they catch the problems. Sometimes it's just asking a few simple questions like, do you snore? Do you have momentary lapses in breathing? Often you may have to ask their spouses or bed partners because they won't give you the accurate information. But when you find somebody that has these kind of problems, the best thing that you can do is get them to have a sleep study. And oftentimes the physician may not know as much as you want them to know to help you guide the patient, and you may need to find a physician sleep specialist. Mostly it's a lack of knowledge. We've got this across the board. We've been doing research to find out how much is being taught in dental schools, and it's nice to see that there's been an improvement in the number of hours on average since 2003 and 2009. And I just completed a study with another doctor at UCLA on the amount of hours that are being taught in dental schools, and it's encouraging, but it's still much too little. So there is a lack of education, there's a lack of ability for interested dentists to get quality training, but if you have a mind to do it, it's out there. I was frustrated with getting the information out about the impact, the enormous impact of drowsy driving. We all know about drunk driving and the impact, and we know that there's more than 15,000 deaths a year attributed to drunk driving. What we don't know, or what is not published so much, is how serious drowsy driving is and how much impact it has. Some of the research by the National Highway Traffic Safety Association shows perhaps 100,000 accidents a year, perhaps 1,550 deaths associated with drowsy driving, and it's just a gross underestimate. It sort of shows a 1 to 1.5% accident rate attributable to drowsy driving. The reality is it's closer to 20%, which means drowsy driving probably has more impact on deaths and damage in the United States than drunk driving. It's just not well published. I wrote the children's book because I couldn't get the information out. The idea was, if I can't get the information out to our current adult population, perhaps I can make a difference by introducing the concepts to children and put it in a non-threatening, fable-type story. And the story is called Bots, Dots, and the Rumble Line, How They Saved the Trees in Snowdon. And it's an entertaining little storybook, and hopefully will help to spread the message.